The Causes of Pain and How to Correct It, Part 2. In a previous article, I explained that the body is neurologically wired to follow the path of least resistance and equally wired to avoid pain. This means if I ask 10 people to walk down the hallway and back, or ask that same group of people to bend over to pick up a shoe, every single person would have their own unique way to accomplish each task. Wired to save energy and avoid pain, each person, based on their flexibility, their strength, and their previous injuries with scar tissue and adhesions, would find a way to do what was asked of them. Yet some ways of walking, and some ways of bending, are more beneficial than others. Some strategies will over time cause joint wear, tear, and pain, while others will preserve joint and tissue health. How you move or don't move matters to your health, and certainly it matters to your ability to recover from injury or degenerative pain. Much like the engineering of a bridge is crucial for its safe operation, or the alignment of our car is essential for its longevity, our bodies are designed as mechanical structures that function best under ideal alignment. Often after having pain or injury, our movements develop compensations to protect that area. Unbeknownst to you, certain tissues have shortened while others have lengthened to accommodate pain avoidance. We also tend to develop microscopic scar tissue and adhesions that cause us to lose efficiency and flexibility. These changes in tissue length and function then result in improper torque on our joints and discs. Over time, breakdown, degeneration, and pain occur. Let me give you an example of this from something I often see in my clinic. Ideal pelvic positioning, or a neutral pelvis as it is often referred to, is a 6 to 8 degree anterior pelvic tilt. Yet patients who have had a chronic history of a low back ache often unconsciously alter their pelvic position and stand with a slight posterior pelvic tilt. This means they stand with a slight tuck of their buttocks and pelvis, which they instinctively did to get out of pain. You might not be able to notice this position on yourself or another person. However, a trained eye can see it, and sadly this compensation removes or flattens the natural ideal curve of the spine. This curve of the spine, known as a lordosis, is an essential part of our structure, designed to provide shock absorption to the lumbar joints and discs. So, driven by pain avoidance, this standing out of ideal alignment now has the consequence of global increased compressive and shear forces, which often result in degenerative injuries. So how can you override your body's tendencies and retrain your body in alignment to get out of pain? Well, as I said before, knowledge is power. Sign up now for the Platinum program and begin learning the mechanics of sitting, standing, and walking to best support your joints. Get positions and exercises that give WD-40 or lubrication to your joints and clear inflammation. Get stretches to relieve sciatica and neural tension, and begin easeful core strengthening to stop the progression of back pain. There are multiple program options within the Platinum program and more being added all the time. Once you sign up, you will have access for life and the ability to do-it-yourself PT as needed.